The Ministry of Health is warning that the country could be forced to reintroduce stiffer measures if the current trend of coronavirus infections continue to rise. The warning came as the country recorded 318 new cases in the last 24 hours, only a day after schools resumed. The Ministry of Health Chief Administrative Secretary Dr. Rashid Aman warned that Kenya was staring at a second infection wave, urging for full adherence to regulations put in place to fight the pandemic.
The upwards trajectory of Covid-19 is now worrying the Ministry of Health. The ministry warning that the nation was edging to a second wave in a day where 318 new cases were confirmed from 2,592 samples, representing 12% positivity rate. The ministry's Chief Administrative Secretary, Dr. Rashid Aman, said the case is scaring now that schools have resumed classes.
It is a likelihood that it can happen. A second wave is a real likelihood for us. I think the data, as we have seen coming in, and we need to watch it very carefully over the next few days and weeks, is that we are beginning to see another steady climb following the relaxation.
As a way of making schools safe, Dr. Aman said the ministry may consider undertaking tests in learning institutions to ascertain the safety of learners.
If a child turns positive in a school, or a child has symptoms of COVID-19, what happens? A test would be done. If it's a public facility, a test would be done. Of course, we have the rapid response teams throughout the country who would be activated to come and take care of that individual.
Aman said the ministry will not shy away from taking drastic measures should the cases continue spiraling.
Today, our positivity rate was 12 point something. These positivity rates may fluctuate over time, but when we look at the 7-day moving average, and then we begin to see that we are moving above the 5% positivity rate, it's a danger sign that we are moving in the wrong direction. And to avoid moving in that wrong direction, we need to be able to strictly adhere to these measures.
In a similar period, 10 patients succumbed to the disease, taking the country's fatalities to 787. In the new cases reported on Tuesday, 215 are males and 103 females. Nairobi registered the highest number at 112, followed by Uasin Gishu at 30, Mombasa 29, Nakuru 25, Busia 24, Kisii 21, Kisumu 19, Kakamega and Murang'a recording 8 cases each, Kilifi 6, Laikipia, Kiambu and Embu recording 5 cases each, Homa Bay 4, Trans Nzoia and Turkana 3 cases each, Machakos, Isiolo and Kajiado recording 2 cases each, Nyandarua, Garissa, Tharaka Nithi, Vihiga and Kirinyaga recording 1 case each.